In New York City, hospitals are under siege by an ever-growing number of patients with coronavirus. Healthcare workers have described the situation as apocalyptic and a war zone. Joining us this morning is a doctor who is on the front lines at a hospital in Brooklyn, Dr. Arabia Mollette, an emergency medicine physician. Good morning to you, Dr. Mollette. I got to let the viewers know that you and I go way back. We've been friends for quite some time here. It has been a minute.
Yes.
But thank you so much for what you are doing. And I want to talk first about what you're experiencing right now on the front lines, specifically within the ER. What are you seeing now on a daily basis?
What I see on a daily basis is a lot of pain and suffering. And the health disparities are real. I mean, we're doing the best that we can as an emergency department. I believe the staff we are strong, because we're uplifting each other and we're helping each other out. But I will say that also that the patients are our strength. They're giving us our strength, and their families as well. And so all of us are trying to fight this epidemic in unity.
What's the majority now within the ER of emergencies, everyday emergencies, right, versus COVID-19 patients? Are you seeing more COVID than other emergencies?
We see everything.
Yeah.
It's about the same.
And what about protective equipment right now? We've heard, obviously, these problems, specifically over at Elmhurst Hospital over in Queens. And there's been a lot of focus right now on public hospitals versus private. What are you seeing in terms of these supplies that keep you safe while you're on the front lines as well?
So like many other hospitals in our country, we are low in supplies, but I did receive word that we are receiving more support. We're receiving more medical supplies as we speak. And people have been reaching out to Brookdale University Hospital and showing a lot of support towards our hospital in the community.
What about ventilators? The mayor was here on Pix 11. He said Sunday is really what he's considering doomsday, when we'll see a real need for these ventilators.
The same thing. We're low in supplies, but we are receiving support, and help is coming along the way.
So for you on the front line right now, you know, we were talking to some nurses last week who were talking about just how they have this interaction with their patients, this human interaction, and it's what keeps them going, that they're able to get up close with their patients right now, and that they're not able to do it because of the distancing and because of the gear they have to wear. Is it making your job more difficult just to practice medicine?
Well, if you come to Brookdale University, you know, as you know, that the report had showed that we were low on supplies, and we still taking care of the patients regardless. And so it's not just the nurses that are feeling this way, it's also the physicians, ER doctors, ICU doctors, the residents are being trained at our hospital as well. We're all feeling the burden. And as well as the people who are registering these patients, the unit clerks, the housekeeping staff that come down to clean the emergency department, as well as the pharmacists, the respiratory therapists. So everyone is impacted by this epidemic. And so we are all carrying this burden. We all are a team. It's not just the nurses and the doctors, it's everyone else that are part of this, of doing the best they can to, I don't know, this is emotional.
Oh, I know it's emotional. I know, I can't even imagine what you're going through on a daily basis. I know you're a positive person and you're always smiling. What is it like for you? How are you handling this right now with these long shifts, seeing this day in and day out?
How can I say this without getting overly emotional? I usually get to work around 6:50 in the morning. And before I start my shift, I pray and I meditate, because I'm constantly reminded what I'm getting ready to face during the shift. Sometimes during the shift, I take a 5-minute break and walk to the ambulance bay to cry and pray again, wipe my face, come back into the trenches. And then at the end of the shift, once I leave out of the emergency department, I'm not even gonna lie to you, I cry again and I pray. Because sometimes I question myself, did I do the right thing? Did I give all the care that I was able to provide to that patient? Was I able to support that family member? And it's unfortunate that many family members are just suffering from this as well. And because now we have to limit the visitations in the hospital.
Right.
And so I'm also thinking of the family members and the community at whole. Everybody's hurting.
I got to tell you, prayers and letting those tears out can go a very long way. What are you doing to anticipate the next couple of weeks here? Is there preparations being made within the hospital right now?
Yes, we are still preparing, like many other hospitals throughout New York City. but the peak hasn't reached yet, but it's getting here. And so
Yeah.
we have to prepare as much as we can. And the responsibility should not only fall on the hospitals at hand, it's the entire nation that also should be held accountable when it comes
Yes.
down to social distancing and staying home. It's going to take the entire nation to help us save us.
Absolutely. Hey, open your window at 7 p.m. Have you heard the cheers for you and all the front line
No,
workers?
I did.
At 7 p.m. almost every night here in New York City. It's been an incredible thing. Everybody opens their window, bangs pots and pans, cheering right now. It was supposed to be just a thing last Friday to thank doctors and nurses on the front lines, and it's really becoming an every night thing. What you're doing is yeoman's work. I can't even begin to thank you enough for what you're doing, to you and your colleagues. And it's not just because I know you. If I didn't know you either, I'd be saying the same thing.
Thank you, Dan. And I am also grateful for the news, various media outlets just putting information out there that is the truth, because initially when this crisis began, it was a lot of misinformation that was disseminated throughout the public, and it caused a mass hysteria and panic amongst many Americans. And so I think you guys are doing a wonderful job just helping people to get the truth so that we could calm down the mass hysteria and that people can take this really seriously, that this epidemic is real. Help us save you, because we are also scared. We're trying to fight for everyone, but we're also trying to fight for our lives as well.
Thank you. And your heart is huge. I appreciate you and what you're doing. And please thank everybody at the hospital for us from the bottom of our hearts to theirs. Thank you.